Hello, this is Michael Wong. I'm an orthopedic surgeon in Colorado Springs. It's my pleasure to introduce and walk through the 2.4 Knotless hip SutureTak anchor. This anchor is a solid body 2.4 millimeter diameter, 9 millimeter length peak device. It's the only solid body knotless tensionable device on the market that fits both through straight guides and flexible guides. The straight guides are very typical and can be drilled with a stainless steel 1.9 drill bit or a 2.0 drill bit. The curve guides come in 12 degree, 16 degree, and 20 degree bends, and the drill bits fit down all three of these guides. There are two drill bits for these drill guides that are all fluted, flexible nitinol. The 1.9 millimeter drill bit is marked with a single mark, laser etching near the tip, and the 2.0 drill bit is marked with two laser etchings. There are several features that I want to highlight about this anchor design and inserter that are relevant to its functionality. As you can see, the anchor comes straight, but there have been some innovations that have been put at the distal end and at the proximal end of the inserter. The distal end of the inserter itself has been made convex, which then mates up with a concave portion of the proximal aspect of the anchor. So that results in a ball and socket type articulation. And this is really important because it allows the anchor to slide through any of our curved guides smooth and seamlessly. On the proximal end of the inserter handle has been made in a smaller diameter. And this is important because it lets you focus your mallet hits on the back of the anchor in a very straight and centered fashion. This allows for the force transfer to go straight down the shaft, which improves insertion. Okay, so we have a right hip specimen here. The camera's in the anterolateral portal. We have a Trimmet cannula in the mid-anterior portal where the probe is coming in. And we actually have a very nice specimen here that shows a labral tear. You can see that. You can see the buckling there. It's unstable. We've already done some bony prep. We've checked out the cartilage, femoral head, acetabulum. There's your frayed ligamentum teres, as we see commonly. We're going to focus on this area here because that's where the labral tear is. So done our bony prep here, done a little bit of decortication, took down whatever pincer deformity there is, and we're planning on putting our first anchor way over here towards the 3 o'clock position. And I think what we'll do is get started with a 16 degree curved drill guide, and then we'll show 12 degree and then maybe a straight as we move forward. So here's the 16 degree drill guide. You can see the laser etching that tells you that the apex of the curve is 180 degrees opposite of that, or the concavity is parallel to that. So we can really just rotate it, and you can see the movement of position, which really lets us focus in on where we want to put the anchor itself. So we can get ourselves very close to where we want to be, and then use the drill angle to walk it down where we want. So we're going to just put that right at the bone edge. And then we're going to drill, and we have the panoscope in place so we can see both the drilling and the articular view. We want to make sure we don't penetrate. And now the anchor is going to be inserted. So we have our anchor in, and we see our typical suture configuration. We have the black and white stripe pull stitch, shuttling suture, and then the main repair stitch, the blue suture. We're going to show a couple of different ways to pass and convert the anchor. I'm going to start with the Swift Stitch device. And what we're going to do is we're going to actually pick it up a little bit proximally, and we're just going to go ahead and pass this across. So the Swift Stitch allows us to actually retrieve this in all one move. But we're also going to show a different technique where we go in with the loop grasper. And what we're going to do here is we're going to go ahead and get the loop suture from the shuttling, and then go ahead and grab the loop suture and the main repair suture all together, and we're going to retrieve that out the cannula. And now we're going to start converting it. So we're pulling on the non-loop side, and you can see intra-articularly that it's converting. And we usually end up with a couple of tugs here, and now it's converted. We'll go ahead and get that down, make sure there's no braids. This is a good time to identify any. And maybe we'll just unwind this with the loop grasper. And this may not be relevant, but just in case, we're going to just take the main stitch so it doesn't wrap itself like that. So now everything's nice and clean. We'll kind of convert that down. And I'll take that loop grasper again just to position the loop as we bring it down. Now, one nice thing about this anchor is it's tensionable. So what we can do is actually leave it just a little bit loose. And the nice thing about this is if you were to send it all the way and tighten it all the way, that's fine. But then it rolls the labrum right up to the bone edge, and that can obscure your next position of your anchor. And so I like to leave it a little bit loose. This gives me full view of my next shot, and we'll leave that one a little loose, and then we can keep going along the way. And at the very end, we can tighten them all and then remove all the remaining suture that we don't need. Okay, so now we're changing over to the 12-degree curve guide just to show a slightly different curve. And once again, you see the laser etching, so you know where the angle is going. And again, just with a small amount of rotation at the proximal end of the guide, you can just see how much mobility we have without having to lever. And so we have a great view of our bony edge, and we're going to be able to put our fixation nice and close. I'm going to set the tip of the drill bit down. There you go. Okay. And then we'll go in and take a look at the articular side, make sure we're not violating that as we drill. And we'll try to get a nice highlight of the anchor going in. And there are our 3 sutures again. Okay, so this time we're going to highlight a technique using piercing type device. Just before we get that in, just wanted to show you that we haven't had to dock any of the sutures outside the cannula. Everything has been placed through the cannula. We haven't had to do any special suture management because we're grabbing everything and passing everything at the joint level. So here's our piercing device. We're just going to give ourselves a little bit of slack here, and then we'll just get on the back side of the labrum. Pass it. And then we'll go ahead and retrieve it. And then we'll go back in with the loop grasper, and we'll go ahead and grab the loop suture and the repair suture together like that. And we'll just bring those out the cannula. Again, there's no way this can overlap or braid with the previous anchor suture because we're grabbing it at the joint level. And we're just going to convert the anchor. Gentle tugs. One other technique is to actually have somebody on the loop grasper as we're kind of applying counter tension as we advance the anchor itself. I'm just going to position the loop right about there. And again, we're just going to kind of bring it down to about that level. And now we have 2 anchors in. All right, so for our 3rd anchor, we're planning on using a straight guide to put it in. So it's already in and in place. And now we're using, this is a stainless steel drill bit, and we can go ahead and start drilling. Okay, so that's nicely seated. Again, we have our 3 sutures. So we've placed our 3rd anchor here and we've converted it. But before we advance it too far, just to show another technique to try to avoid the wrapping of the loop like we saw in the last anchor, what we're going to do is go ahead and reutilize the shuttling suture. So we didn't throw it off. We're just going to pass it through the converted loop. And we're going to have our assistant just hold on to that as a counter traction while I advance the anchor down. And you can see there's that counter tension suture. And as we get closer, they can just remove it now. And you can see what that did for us. It allowed the loop to be very clean and neat. So now we have 3 anchors in. And I'm really liking the way this looks. So we're going to highlight the tensionable aspect. So I'm going to go ahead and take that third one, and then we'll go ahead and take the second one. We'll unlock that, and we'll just kind of tension that. And then maybe go to the first one and tension that. And the beautiful thing about this mechanism is we can go back and revisit. So I can go back to number 3. Just get the last bit there. Number 2 and number 1. And now that I like that repair, we're just going to put the cutter in, and we'll be able to cut all the sutures at the same time. We'll start with the first one, second one, and third one. And there's our repair. Here's the finalized view with the traction off. You can see we've restored the seal of the hip joint. The femoral head's now reduced. The labrum sitting anatomically. Again, you can see most medially over here, that was our 16-degree curved guide anchor placement. Then this is our 12-degree, and then this was our straight, highlighting the tensionable aspect of the 2.4 knotless hip SutureTak anchor.